All right, my clock says 5:05, so we'll go ahead and get started if that's okay with you all. So I wanted to thank you all for joining us for the Maize and Blue Cupboards Learning Series number 3 on the topic of the shape of the world's food systems. We're joined today by our speaker, Lilly Fink Shapiro. Lilly is the program manager of the University of Michigan Sustainable Food and Systems Initiative. She uses her expertise to promote collaboration and innovative initiatives with over 60 interdisciplinary faculty across campus who study and teach about food systems. She co-leads the Food Literacy for All Community Academic Partnership class and engages in research related to food systems, equity, and public health. Her experience includes evaluating the Michigan Good Food Charter Project and national efforts to promote racial equity in the food system. She works with the Double Up Food Bucks program, and her consulting projects include strengthening the network of food councils across North Carolina and Michigan. And with that introduction, I will turn it over to our speaker.
All right, thank you so much. Thanks to Victoria and to the whole Maize and Blue Cupboard team for inviting me. I'm excited to be here and to chat with you all. And I know ahead of time we were talking about I'd like to make this as interactive if possible, and trying to figure out how to do that with this format. So you can type things in the chat box at any point, and if I see them, then I can derail and try to get to them live. Otherwise, there's definitely going to be time at the end, and I'm definitely gonna ask you all for some ideas. So let's get started. So again, this is just quickly that I work with this group called the U of M SFSI, the University of Michigan Sustainable Food Systems Initiative. And a couple things, we have an undergraduate minor in food and the environment, maybe you know about it. We have a graduate certificate in sustainable food systems, and we have lots of food systems coursework across campus. In another week or so, we're going to put out a guide of all of the food systems courses next semester if that's something that might interest you. So look out for that. So I know I was already asking before, a few of you showed up after I asked, but I really just want to get a sense of who you all are. And Victoria did a nice job. It sounded like, if you haven't already typed in the chat box, please say, are you a student at U of M? And if you are, or maybe you're a student elsewhere, maybe you're not a student at all. I'm curious to hear who we have with us and what you're studying. If you even want to drop a note, clearly something drew you to join us today. So if you even have thoughts about what you're curious about, what you're hoping this will cover, feel free to type that in the chat box too, and we'll try to make this as relevant as possible. So I'm hoping the chat box is like a flowing piece. So we'll take a minute. Those of you who didn't say yet, are you students? Are you tuning in from Ann Arbor? Are you in another state or elsewhere? Okay, while you're still typing in the chat box, I'm just gonna let you know what the topics we're gonna cover today. So we're gonna start off talking about all the major challenges in the food system, and the 3 major perspectives that we're gonna cover are the food system from a health perspective, climate change, and equity and access. And then after we talk about all these major challenges, we're gonna take a breather and talk about what to do about all of that. So hopefully it transitions to a little more positive tone. And I see some of you wrote in the chat box. All right, we've got a C's graduate student, an intern with M Dining, student from Ann Arbor, classmate told me about the event. Great. And also, if you just joined, you're welcome to type in your favorite breakfast food. Some people were writing that beforehand while we were waiting around. All right. So that's kind of the agenda for today. And we are going to start out with this first point about talking about health. Okay, so there's some grim numbers and statistics and things to share with you here. I'll try to contextualize them. So when we're talking about this country, more Americans are sick than are healthy. 3 in 4 American adults are overweight and have obesity. And as we know, these trends have worsened during the pandemic. Almost half of the entire adult population has prediabetes or diabetes. And I mention these because these are all conditions that are related to diet. We also know that there's about a third of premature deaths in the US are attributable to poor nutrition and physical inactivity. And for the first time in reversing a many centuries and millennia long pattern, children born today are actually expected to lead shorter lives than their parents. So then taking a step back from this country and looking globally, 1 in 5 deaths are associated with poor diet. So clearly diet is central to health. And I like to pick on sugar sweetened beverages just because it's the easiest health topic to pick on. It's the most clear cut. So I included this, that on average, the world drinks 10 times the recommended amount of sugar sweetened beverages. So, you know, pop, soda, Coke, Pepsi, however you call it, that's what we're talking about here. There's 842 million people around the globe that are undernourished, and almost half of all child deaths, so children under 5 years old, are linked to malnutrition. So some pretty serious numbers here. Back to the US, when we look at the leading causes of death, the main point here that I want you to notice is that the ones in blue are all related to diet. So again, diet has a major health impacts. And, you know, you can look at this from a lot of different ways. You can also look at the economic costs. It's to our country and to our world. So I'm showing this graph with a few caveats. So the main thing I want you to notice is just that obesity rates started going up drastically right in the 1980s. And, you know, if things change that fast, the main point that I get out of this is that this is not because of physiology and genetics, because you can't change that fast in a generation. This is clearly societal, cultural changes that are driving this. And so that's really what I take from this. And I am now it's 1 in 5 children who have obesity. And of course, we know that with the pandemic, these numbers have only been rising. Here's some more grim statistics for you. Okay. Related to COVID, nearly 2/3 of COVID hospitalizations in the US were related to these diet-related conditions. And we know that before the pandemic began, it was about 42% of adults, about 100 million people who were suffering with obesity. And a recent study found that patients with, you know, I don't want to focus too much on BMI, but I think just for this it's helpful. And then I'll give a caveat of why I don't want to talk too much about BMI. But patients who had a BMI of 45 or higher were about 1/3 more likely to be hospitalized with COVID. Okay, so I think this part here from Dr. Stanford is really important. So my biggest point related to all these stats is that because these numbers are so high, this is not an individual issue. This is not something that we can fix based on personal choices. And now I just talked a lot about obesity and overweight, and I've been learning more about how one of the least discussed public health issues is actually weight stigma. And there's really weight discrimination is, according to some studies, even more prevalent than discrimination based on race or ethnicity. And there's really compelling evidence that weight stigma is harmful to health, and even more harmful than, you know, focusing on BMI and trying to reduce people's BMI. Sure, that might be helpful, but compared to the weight stigma, that it's actually the weight stigma harms outweigh the BMI benefit. So there's decades of research about this, and it's in the last couple of years is really being taken off and understood more in mainstream media. So I just want to flag this, that's a really public health issue. And I understand that talking about some of these issues can be triggering to folks. I'll share a little bit more of that I learned about this recently. So about 40% of people report past experience of weight-based teasing, unfair treatment, and discrimination. And the fact is that it doesn't help. So contrary to public perception, weight stigma does not motivate people to lose weight. Instead, it worsens health and reduces quality of life. And that the harmful impacts of weight stigma are real and long lasting, and they can lead to really intense emotional distress, depressive symptoms, anxiety, low self-esteem, disordered eating, unhealthy eating, low physical activity, and even avoiding healthcare. So this needs to be a part of the conversation alongside everything else that I just shared. So these two images people used to think that the image on the left, which is more about chronic hunger, stunting, and wasting, used to have nothing to do with the picture on the right, which is more associated with higher income countries. Now, really, they're actually quite related, and they signal this global double burden of malnutrition, and they're both a symptom of a food system that is not working for everyone. The World Health Organization, the WHO, defines the double burden of malnutrition as the coexistence of both undernutrition alongside overweight and obesity or diet-related non-communicable diseases. And it's interesting because it can happen not only within the same countries, which is happening more and more, but it can also happen within the same household and across the life course. So someone who suffers from one of these conditions might suffer from another condition even in their same life. So this is a growing issue. And again, these conditions used to have, people thought they had nothing to do with each other, but it turns out that that's certainly not the case. So here's the reason that I have a background in public health, and the reason that I went to graduate school to study food systems. And the reason that I decided to focus my career on these issues is that these outcomes are not inevitable. It doesn't have to be this way. These are, again, non-communicable diseases, and we can do something about it. So however, I'm not under the illusion that it's not simple. Unfortunately, I can't tell you that there's some silver bullet, but I do think that this is preventable on this massive population level scale. So now I want to take a step away from the food world for just a moment. Let's go backwards a few decades. Imagine we're in the 1970s. And let's just say each of you here on this Zoom call, you're each a physician. And every patient you see coming in the door, basically 2 out of every 3 patients you see coming in the door, comes to the doctor because of some kinds of injuries or complications because they weren't wearing their seatbelt. And this is day after day, month after month. Basically, all you're seeing is patients who are getting hurt because of a car accident. And you have different choices. You might say, this is a personal issue. Everybody needs to figure this out for themselves. You might say, you might tell each patient, have you heard about defensive driving? Do you know about wearing seatbelts? And you'll just really take time, sit down with your patient, explain to them the importance of wearing a seatbelt. And you think once they understand the rules of the road better, they won't get into so many accidents, and then maybe they'll change their behavior. So that's one approach. I would argue that's probably not the most effective, but you might do that. Okay, or instead of doing that, you might look at policies in the environment and you say, hey, let's make laws so that if people don't wear their seatbelts, we're going to pull them over and they're going to get fined. We're going to say, let's change the way that we make automobiles so that there's all these safety features, airbags, seatbelts, all these safety features built in. You might, you might do things like require kids to ride in car seats. You might change the built environment. You might make speed bumps and traffic lights and all kinds of what they call traffic calming measures. You might, create speed limits and actually enforce that these traffic laws are followed. These are other approaches. And this in hindsight seems so obvious, but I will tell you that was not always the case. So I love this article that I found. This is a New York Times article. I found this, it was from 1986. And there was a proposed rule to require the installation of seatbelts and shoulder harnesses in all passenger cars sold in the US. And the auto industry, much I argue like the food industry, fought the proposal. The auto industry said, that's crazy. No one's going to like that. We're not doing that. They're uncomfortable. No one's going to like them. Drivers aren't going to like that in their cars. And this is, this was not obvious at the time. This was a real fight. And I argue that looking at the environment, focusing on policy is what it's all about. So you got to fix the environment, not the flower. And I think that's the argument I'm trying to get across with these stark numbers and the diet-related illnesses. This is not an individual issue that we need to approach by talking to each individual person. Okay, so I'm going to transition us. We're going to move ahead here. We just talked some about the health impacts and the challenges, the health impacts of our food system. And now we're going to switch gears to talk about health and climate change. All right, so the food system contributes over a third of human greenhouse gas emissions are from the food system. And that includes, it's the whole food system. So it includes farming, grazing, transportation, packaging, production, the whole thing. And well, that's pretty big. I'll leave it at that. Okay, perhaps you've seen this. This is becoming, more and more widely known. I like showing this graph because it's actually research done by U of M faculty in the Center for Sustainable Systems at SEAS. And so this is all about the carbon footprint of different food that we eat. And the biggest emitters, beef and lamb, are right up there at the top. Lentils is always down at the bottom, vegetables. So, you can compare a meat-centric diet versus, less meat, vegetarian, vegan, of course, all have lowering carbon footprints. And as we know, generally omnivorous diets have a higher carbon footprint than veggie diets. And the other thing is that, related to climate change and food, is that climate change is affecting our very ability to produce food. We're having more extreme climate events, more floods, more fires, more extreme heat events, and around the world, it really is affecting our ability to produce food. So another way that the food system is connected to climate change is through the mainstream animal agriculture in this country. And interestingly, more and more, it's a newer argument, at least in the mainstream, but that there's more and more critics that say the way that we raise animals in this country is ripe for another pandemic. And some folks have been saying that for years, and now all of a sudden people are understanding that in a different way in terms of the spread of disease in conditions like this. Our current system of industrial farming, there's severe environmental impacts, it's clearly inhumane conditions. And I think that argument about being ripe for a pandemic is a strong one. Another issue we can look at is that sure, some antibiotics are necessary for human health. Are necessary for human and animal health. But when you look at this, 30% of all antibiotic use is by humans, 70% are consumed by animals. And much of that, certainly when an animal is sick and needs antibiotics, that's an appropriate use of it. Much of that antibiotic use in animals is actually preemptive because they're eating diets that are not good for their guts. And so if they're given antibiotics ahead of time, they won't get sick. But that's not necessary. And if they were eating, for example, if cattle were eating, if they're on pasture and eating food besides corn feed, they wouldn't necessarily need that. So I think that's a really important part of this piece. So we can also look at systems of monoculture agriculture, which looks like this from the sky, which really threatens biodiversity and ruins an ecosystem and transforms habitat and leads to overharvesting of wild species. These are all powerful arguments and connections between the food system and climate change. And certainly we could do a whole presentation and more just on this topic, but it just gives you a taste of different connections there. Okay, we're going to switch now to talking about issues of equity and access in the food system. So in the US, 1 in 5 children are food insecure. And there's, here I am giving a talk at the Maize and Blue Cupboard. You all are probably already familiar with these issues. As we know, there are food insecure kids in every congressional district, in every demographic. It looks different in different families. It might be that a family has money to buy groceries 3 out of 4 weeks, or it might be that it's a mom or a family member skipping dinner. Or in a lot of cases, a family might have to choose between buying groceries or paying rent, or paying for medical bills or buying groceries, or paying for transportation and buying groceries. And we also know that, and I guess this is a number from pre-pandemic, so it's likely more severe now, but 90% of SNAP benefits are redeemed by day 21 of the benefit period in the month. So that means that they don't last all month. So that can, tells a picture there. And this is a quote from Leah Penniman, who we had come speak at the Food Literacy for All course a couple of years ago, actually. She was our last speaker before the pandemic. So I guess it was early March 2020 when she came to campus. And I think it's important to note that food security does not affect everyone equally. And when we discuss racism in the food system, we can't just talk about how food is produced. We also need to talk about who gets to eat that food. And I think if you're going to talk about food justice, you also have to talk about racial justice. It's deeply intertwined. So let's keep exploring this theme a little bit. So there's a lot of different components to food access. One of them is just physical. So this is an obvious one. You know, if you live in a place where the food outlets, the stores near you look like this, it's, you know, you're more likely to buy these kinds of things because that's what you have physical access to. That's what physically surrounds you. And you all have probably heard the term food desert. A lot of folks that I respect and look to on these topics really are trying to move away from that term, because for a few different reasons. For one, the term food desert applies, the idea that we're supposed to think of is that there's nothing there. Whereas let's think ecologically, we know there's actually a lot. In the ecosystem of a desert, there's a lot of living things. There's animals, plants, there's a whole beautiful ecosystem there. So that doesn't really work with the term food desert. The other thing is that it makes a desert is natural, and it makes it sound like a food desert is a natural phenomenon, which it's not. And food deserts are really products of structural systemic racism, and it's not that there is nothing there and it's not a natural phenomenon. So some people say food swamp. They say it really is filled with things. We should call it a food swamp because it all is food environments that look like this. And then other people more recently say, no, it's not food swamp. What we really need to call it is food apartheid. And that's what I call it. That's accepted in a lot of circles, that is because it implies this deep structural inequities in our food system. So I think that's probably the best term when we look at food access. And, you know, in this picture, what we see here, just to describe what we're all seeing, is it's a lot of really highly processed foods, high in salt, sugar, and fat, right? Or we might call them food-like products. Some people call them that. Okay, so let's look at another aspect of food access. There's obviously financial. So let's say you live a block away from a beautiful full-service grocery store. You might have physical access to it. You can walk there, you can get there easily. But you might not have financial access. So we know cheap food is the unhealthy stuff. So the healthier food is more expensive. And so financial access is clearly a huge component of this. High caloric food and low nutrient content is cheaper. And some people wonder, I think people are starting to understand, but there used to be this trope of how are people who have obesity food insecure, and people didn't understand. And people would think that food insecurity means caloric deprivation. That's not the case. And I think this image helps to explain that and helps to debunk that idea. Okay, another component of food access is the cultural side. So having access to what the term is culturally appropriate foods is a really important dimension of food access and often gets left out. So this picture of collards and curly kale, you know, there's a lot of nutritionists out there who are pushing kale recipes, and pushing kale recipes to folks who maybe have never heard of kale, have never used kale, didn't grow up eating kale, don't know how to make it delicious. However, there's another plant, collard greens, which nutritionally are extremely similar to kale. And folks might be really familiar with collard greens, know how to make them delicious. Maybe they've eaten them their whole lives. So it's really important to be able to have food that reflects financial and physical access to food that reflects our cultures. And I'm sure you all at the cupboard are thinking about that all the time too. All right. So now this is a slide, no matter what presentation I'm giving, I figure out a way to put this in here. And I'll say it a couple of times. So all of these food insecurity, it's not because we don't grow enough food. It's not because the population is growing and we can't feed them. We grow more than enough calories worldwide to feed the population. The issues are because of a lack of equity and access. And as this author, Frances Moore Lappé, argues, democracy. It doesn't have to be this way. And some people say that this estimate of calories per person per day is actually a conservative estimate. So it might be actually a lot higher than that. So again, food security is not about a lack of food, but it's about a lack of equity. Here's another component of it. So we grow enough food to feed the world, but we waste almost half of it. And I've been talking to more and more students who are interested in food systems and want to get in touch. And increasingly, it sounds like students are interested in tackling this. They realize how crazy it is that we waste almost half of the food, and they want to do something about it. So if you want to look at it in terms of oil, the wasted food accounts for 300 million barrels of oil per year. And there's almost 1 billion people going hungry while we waste a third of the food that we produce. So there's different numbers. So I've cited where I got this one from, but there's different estimates. And food is wasted all along the supply chain. In the US, a lot of that food is wasted at home in our fridges. It looks different in different countries that have varying levels of refrigerated supply chains. Sometimes people are really efficient in their homes and they're not throwing away much in their kitchen at all, but the supply, it might be in the field, they can't harvest it fast enough, or maybe they harvest it in the field, but they don't have refrigerated supply chains to get to the corner store in a rural part of their country, and things go bad then. So it really looks like food waste looks different in different places. It certainly happens all along the supply chain, but it happens the most in different parts around the world. Okay, here's another big part of our food system we haven't talked about yet, is the restaurant industry. So the restaurant industry, it's one of the major employers in the US, and at least pre-COVID, 1 in 12 Americans worked in the restaurant industry. I'm not sure how that has changed now. And of course, we know that there's a major labor shortage going on in the restaurant industry right now. And so 1 in 12 Americans, that is a big employer. And one of the equity issues is that 90% of women who work for tips in restaurants report experiencing sexual harassment in the workplace. So maybe have you heard about tipless restaurants? And so there's a lot of restaurants who are starting now. There's a couple in Ann Arbor who are starting to say going tipless, and they're building the wages into the workers' salary. So it's good for a lot of reasons. But one of them is that servers don't necessarily have to put up with sexual harassment in order to get paid. They also know more or less, how much income to expect each month, and they can figure out their rent and childcare and transportation, all their life costs because of that. So it's a really positive movement. And if you check out a group called Rock United, you can even find a directory countrywide of what restaurants are abolishing tips, which are actually a legacy of slavery. So you can read all about it. Saru Jayaraman, who we also had as a food literacy speaker, will tell you more about that. Okay, so moving on, another sector. So less than 2% of farms, I think it's actually closer to 1%, are owned by Black farmers. And now owned is of course different than the farm workers. There was a famous case, there's a lawsuit, the Pigford case, Pigford versus Glickman, which was a class action lawsuit against the US Department of Agriculture, against the USDA, that unveiled this historical pattern of racial discrimination in the allocation of farm loans between the years of 1981 and 1996. And folks already knew that was happening, but it was a really big deal to have that come out in this case. And if you're interested in these topics, check out this resource by our friends over at Michigan State University at the Center for Regional Food Systems, put this together. There's over 200 publications and videos that explore specifically structural racism in the food system. And this most recent one just came out January of this year, and I know now they're working on the 8th edition. And there's all kinds of resources, including the videos from Food Literacy for All are included in that. But it's worth Googling, or if someone wants to put a link in the chat box, you might want to check that out. All right. Moving on to the menu. Sometimes it takes a minute here. Here we go. Okay, so clearly there's a lot of challenges in our food system. And now let's transition to what can we do about it? I know many of you are students studying diverse fields, which is great. And because clearly food systems touches everything. So let's just go through some ideas, and I'll share some ideas, and then I really want to hear your ideas too. And I was actually thinking, I just want to add more slides to this with your ideas. And I just put these in here as kind of a visual palette cleanser so that we can move on to the next thing. Okay, so clearly we need to work at all levels across sectors. Hopefully you've come away from this understanding that the issues in our food system related to health and climate change and equity, these are not individual issues. These are systems level wide issues. And certainly the public health folks on the Zoom will have seen this model before. This is really a theoretical framework. It's called the social ecological model for understanding how factors influence health and specifically diet disparities at various levels in different populations. So at the individual level is like what I was talking about, that example of the doctor talking to their patient about knowledge and attitudes and skills and just know about defensive driving and wear your seatbelts. And certainly there is a role for that. I'm not saying there's not a role for that, but that's not our only way out of this. That's just one tool in this multifaceted toolbox. All right, so let's talk about what we can do. Okay, so one thing, there's not enough room on this slide to put all the local groups who are advocating for change. But for those of you in Ann Arbor, maybe you know about the Washtenaw County Food Policy Council. On campus, there's my group, which is the U of M Sustainable Food Systems Initiative. This University of Michigan Sustainable Food Program is a student-led group. There's the Detroit Food Policy Council. Oh, if you hear that, that's my smoke alarm going off, but I just think it's because there's something in the oven. So don't worry about the beeping if you hear it, it's on my side. There's a group of local activists called the Local Food that run a local food summit. Then there's a statewide work called the Michigan Good Food Summit. You can support agroecological farming systems. There's just some pictures I took in Cuba that might look like this. You can frequent businesses run by women and people of color. There's an amazing group called Food Lab Detroit that focuses on these businesses. I love this article about fighting the patriarchy with Sister Pie. We can incentivize healthy eating. So maybe you know about Double Up Food Bucks, which doubles your money. If you are receiving SNAP benefits or food stamps, you can double your money to buy fresh fruits and vegetables. There's this pharmacy is this idea of doctors giving out prescriptions for health of, okay, here you can get a prescription to have this money to spend at the farmer's market, that kind of thing. So there's more and more of those types of programs popping up. Screening food security alongside other social determinants of health is a really important one, and that's happening more and more. I'm glad to see that happening at the doctor's office. You can support, there's even legislation to end weight stigma. Actually, Michigan, I believe, is the only state in the country that federally protects workers from weights being discriminated for by their weight. And now there's legislation that folks are trying to pass in other states. So you can join those kinds of efforts to try to pass those policies. You can advocate for other health promoting policies. I'm in favor of soda taxes, which have been passed in increasingly cities and counties and have had favorable results so far. There's innovative farm to school programs. There's other policy platforms like Plate of the Union you can check out. We can grow food everywhere. We can, it doesn't have to be just this urban rural divide. We can grow food in cities, on rooftops, in your backyard. If you have a little window somewhere, we can start growing food. I had to include this quote from Fannie Lou Hamer about if you give somebody land, he will grow his own food. We can regulate the marketing of junk food. I have 2 little kids, and I know if they go to the grocery store, they don't care what's actually in the box. If they see a character that they like, they're going to want that product. And for the most part, products that look like this are really just products high in salt, sugar, and fat. And it's really devious and makes me so mad how effective and brilliant, really, the food marketing towards children industry is. But I think that we should take this same concept, take the same energy, and sell healthy food like junk food. So how come when you buy baby carrots, it doesn't look so exciting and have the kids' favorite characters on it? Finally, Sesame Street got into it recently. Maybe you've seen Michelle Obama had a recent Netflix show targeted towards kids. It was all about fruits and vegetables, and it was pretty fun, all about taste. So I think there's a lot, there's so much opportunity, that we can do there. I don't know, why don't we see baby carrots on billboards like we see Cheetos? We can embrace ugly produce in all shapes and sizes. this was from a grocery store in France. It's more and more becoming mainstream to perhaps sell, a huge amount of food didn't used to make it to the grocery store just because it didn't look right. Someone has to run, but thank you. Thank you, Caroline. All right, I'll keep going here. Why don't, we have ice cream trucks going around our neighborhood in the summertime, but what about fresh vegetable trucks and what about, why can't we have trucks with smoothies that play music and go around our neighborhoods and get people excited about it? You can support pasture-based animal farming. You can eat lower on the food chain. There's even a group, there's in Detroit, there's a cricket farmer that I know and we've had as a food literacy speaker. That'll really probably even lower than lentils in terms of that graph that I showed. You can study food systems. This is the class that I co-teach next semester, Food Literacy for All. It's going to be on Tuesday evenings starting in January. So you can study food systems, you can minor in food and the environment, you can get a graduate certificate if you're in grad school. This class is incredible. It's a community academic partnership. So we make all the course decisions with food justice leaders in Detroit and engage community members as much as possible. And I hope you will consider taking it. It's called Food Literacy for All. Also, if you haven't heard about this yet, I have to share, we're so excited. We have in total over $1 million to give scholarships to students who want to come to grad school at University of Michigan and study food systems. And this money is specifically for underrepresented students at the university. And you can read more about it. It's the Transformative Food Systems Fellowship. Someone can maybe put it in the chat box if it's easy. If you Google that, you can find more information. But again, it's for 3 different grad schools. So for SEAS, School for Environment and Sustainability, Urban Planning, and the School of Public Health. And the applications are due in January for the fall. And it's going to be 2 cohorts, but the first fall will be next fall. All right, so here's my major points in summary. Our food systems are harming us and our planet. We know this. Time is running out. We really have to do something in terms of climate crisis. We have the research. We know it's not a mystery. We know what to do. There's enough evidence to start making changes. And I think the only way forward is collaboration across sectors. And we have to use a systems approach. There's no silver bullet, but that does not mean that we should just stand by and do nothing. So now I really want to hear your ideas. I just listed a bunch of things of what we can do. I want to hear your ideas and your questions and someone else has to run. Thank you. So yeah, I want to hear thoughts, reactions, questions, and also your ideas. So if it's easiest, you're welcome to unmute yourself. If you can do that, otherwise type in the chat box, whatever way feels easiest or most comfortable for you. But is there anything that stood out, anything that was new for you? What are your ideas? I'm really curious to hear from you all. So here's my name. I'll go back to your ideas. Interesting point about the way that we advertise food. Yeah, there's this whole world of food marketing, and it makes me mad, but I really think it's brilliant. And in addition, I didn't talk about all of this, but have you heard about behavioral nudges? So when you think about it, the grocery store is one of the most calculated spaces that we ever enter in our lives. So the grocery store, everything's calculated. They've even put little chips, like to do studies inside the grocery carts to see where people go, to the patterns of where people go in the grocery store, where they spend the most time, where they wait and pause, and they're trying to put items strategically in that environment. And the end caps of aisles, like at the very end, so between the aisles, is one of the most lucrative areas. And so companies actually pay big money, like Coca-Cola will pay big money to get to the grocery store to get their product featured on the end cap, because they know, just psychology, that we see something there, we're more likely to take it. I think it's also, they know that if a product is on our left side versus our right side, and I'm forgetting which it is, we're more likely to reach for it. So it's again kind of throwing the idea of individual choice, that these are not individual issues, and that these are systems level problems. It just reinforces all of that. And even putting food lower to attract kids is definitely, you know, kids are shorter, and so their eyes see things lower on the shelves, and that's all intentional too. And I don't know, do you guys at Maize and Blue Covered, how much do you all pay attention into like the placement of food at the cupboard and trying to push different foods and, you know, labels and all of that?
We have it set up so that you kind of have to stop by a produce section first, and then you swing around to more produce. So we kind of do a little bit of both. We're pretty limited in the space we have and the ability to shift things.
Sure.
But we try and get that produce at the front.
Nice. Yeah, and I feel like almost every, I don't know if this is the case, the cupboard, but almost every grocery store I go in, the milk, I have to walk the farthest to get to the milk. Not all, but mostly. And then, you know, there's like a triangle between the milk, the bread. There's one other item. So they make you do the most steps in the store so that you'll probably pick up some other things while you're in there.
Hi, I was going to ask another question. Oh, sorry if I cut someone else off.
No, you go ahead. Ask your question.
So I'm interested, I kind of jumped in like 10 minutes late, but I came to the School of Social Work here to actually look at food and the intersection between food and social work.
Nice.
But I see that like you're working with across kind of 3 primary schools, it looks like. So where do you see like, I mean, I guess seeds and then public health, and then I don't remember the third one that it sounded like was
urban planning.
Urban planning. So if you were to think like broadly about social work, do you know of any connections existing? Is there research in that area that you're familiar with?
Totally. And also I mentioned those 3 schools specifically because the fellowship in particular, where we have the money to fund incoming graduate students, is to fund students in those 3 programs. But I will say that the group that I work with, which is this SFSI, the Sustainable Food Systems Initiative, is like 70 faculty and staff across, I forget how many units, over 12 units in different schools. So we have affiliated faculty and staff, you know, across the university. And I certainly don't see food systems as only in those 3 schools. But in social work, I'm not sure if we have, I have to check our website. So on our website, we have all of our affiliated faculty and staff by school. So you can check by school who does food systems work. I'm not sure we have anybody right now in the School of Social Work. I do know that there is an evaluation group in the School of Social Work that does some food systems evaluation research. So I know specifically that they do some of that. But in terms of classes in the School of Social Work, I would have to look. I know that there's some activists, food justice folks in Detroit who occasionally come and speak in social work classes, which I could find out. I'd have to check, but if you send me an email, I can tell you which classes I know of. Are you looking, have you found that there's much going on in the School of Social Work for you to dig into food systems wise?
There are a lot of students that are interested in it. In fact, like we had a group coalesce around kind of interest in food in terms of in our community change class. So there's an interest there, but I just don't know to what extent that connection between like, obviously we know food and social justice are connected, but between like social work as a field and food as an area of interest. I don't know to what extent that's been articulated.
What about, maybe, will you send me after this, will you send me an email? I would love to connect with you and other social work students who are, you know, interested in pushing for more classes. Here, I'll put my
I think my group, we have a group of like 6 of us that, you know, look at food issues and like cook together every week and are involved in various ways. So we can reach out. Thanks.
That's awesome. I will say also check out Shiloh Maples. She is an alum of the School of Social Work for grad school, and she now does all this really cool indigenous food sovereignty work in Detroit, and I think now she does national level work. But this was now like a decade ago, but when she was at the School of Social Work and she was interested in food systems, she was basically like laughed at, and people are like, you don't study that here, that's not related. She's like, she thought it was crazy. And now she's just saying that there's so much more understanding of how these issues intersect, but that's how it was a decade ago. I would hope that things are not the case. That's not the case anymore. but let's connect, and we can find the kindred spirits in the school social work world. And then also, like, you all can take classes outside of social work too, right?
Right. Yeah. I might
Yeah,
look
so
at the classes.
have your folks, you should register for food literacy, and we'll put out a course guide soon. That's what I said at the beginning, maybe you missed it. A course guide soon of all of the food systems courses on campus. So if you can take classes outside of that, that would be nice to connect with.
Great. Thank you.
Yeah, thanks. If somebody else was about to say something at the beginning, so please jump in if you're still here.
It was me, Victoria. I had to jump on my phone because my computer's frozen, but I just wanted to say I am definitely in part of the social work and food literacy overlap. So I also can be a resource and would love to get resources as well. So if I can be included on those email chains, that would be great too. Thank
Awesome.
you.
Awesome, great. What about anyone else? What are your ideas? What do you think we should do? You know, I listed a bunch of ideas, but there's so many more. Is there something you're involved with that you think would help? I see Elizabeth here. Hi.
Hi, when you were talking about the food advertising, I was thinking about how, we don't advertise. Yeah, of course, you don't advertise vegetables in the same way, largely because they're not a product. And the kind of companies that create them are very, very different. Like, Cheetos are a product and they get put on the shelves, and they've got big Cheeto money to get them on those shelves. Whereas, like, a lot of the produce that we have is sourced from farms that also have a whole system of, bad labor practices. So they're just kind of concerned with, like, getting it on the shelf. But I was thinking about the subscription services that give you the ugly food. In that way, they found a way to make regular produce a product again.
Mm-hmm. Mm-hmm.
One of the failings of that is, I think, sometimes when we turn vegetables into products, it does, like, it's either like, if we turn vegetables into products, it's either going to be like a food subscription service where they're trying to make a profit off of, like, giving you vegetables at a lower cost.
Right.
But on the other hand, I was wondering what you thought about, like, organic vegetables and then the way that we do turn, like, produce into like products. That was a long intro, but
yeah, no, I mean, you raised so many interesting points there. One thing that I didn't discuss I feel like it's relevant, and it didn't come up in my slides, but it seems relevant to the points that you're raising, Elizabeth, is that, like, to me, it's wild that food that has so many ingredients, let's take a bag of Cheetos, food that has so many ingredients, has been processed, has probably been shipped many different places in order to make it, has a huge marketing team to go along with it, has to pay for primo shelf space in a grocery store, is more expensive than, an apple that came from a Michigan farm and didn't have nearly so many steps. And obviously one is perishable, one is really not. So that's an obvious part of the equation. But I think the other part is policy and subsidies, and so many of the products that are going into a food like Cheetos, which, corn is a huge, corn and sugar, and not necessarily for Cheetos, but for, I think it's 2/3 of our groceries, like our everyday groceries, have sugar in them. So just the cheap foods that are, because of US policy, are so cheap, are a reason that they then have money to have a whole Cheeto lobby and are able to get together and make their products so sexy and make us want to gravitate towards them. What makes me really mad is that those are the ones too that have the health claims on them, talking about all the different nutrition health claims, whereas the stuff that's actually, very nutritious is just humbly sitting there and doesn't have all the health claims. Like squash is just sitting there on the shelf. It's not yelling at you with big colorful font. So anyway, I think about that. But yeah, your point, it's totally, it's a really good point. And maybe I should add some slides about that for the next time I talk about these issues. Do you have a specific question, Elizabeth, related to it? Or do you want to share more about your experience with that topic?
Not really, but something I just thought of when you were talking about it is how grocery stores don't charge a tax on non-processed foods. And it just like popped into my head because that's a great example of the way the systems that you're talking about can facilitate making like healthy food more equitable.
Right. Yeah, sure. Yeah, thanks for sharing that. Anybody else want to jump in? Let's see. Karen, Kelly, I'm not sure if I'm saying it right, Sachi. If you want to jump in and correct my pronunciation, raise any questions, please do. Thanks for joining us today. And any more, and again, you can ask a question or you can just share something that this presentation made you think of as a discussion. Karen says, I always think of the importance of getting involved at a local level. Totally. Yeah, definitely. And I know that, you know, today I was trying to talk both locally and globally, but in terms of getting involved at a local level, there's so much going on campus for students. And there's so much going on in Washtenaw County and in Michigan. Kelly loves a tipless restaurant. That's awesome. And I will say, just put in a plug for Michigan. So I'm not originally from Michigan and I moved to Michigan. I was in California beforehand. When I moved to Michigan, I'm thinking like, I had been in California and I was like, how do you grow food in Michigan? I was just like, I didn't really understand. That was before I learned about hoop houses and season extension technology. And that was also before I learned that Michigan, we're actually second to California. We grow the second most diverse set of crops in the country, second to California. So there is so much, I think in part because of that. And in part, we just have so many rich farmers markets and so many year-round farmers markets. You know, I'm sure if you've been to Argus Farm Stop in the wintertime, or even just the Ann Arbor Farmers Market in the wintertime, you start to understand how rich the local farm landscape is, even in like February when you wouldn't expect it. Oh, good. Good to know, Victoria, a fellow non-Michigander. Yeah, and now, by the way, we have like a hoop house in our front yard, like a mini one that's so cool. And then we unveil it and the neighbors can see all the little greens growing when it's been cold outside. It's very fun. So I got on board. Anyway, any other questions? And if to put in a plug, Kelly, for the tipless restaurants, I'm trying to think, what's it? Oh, Miss Kim is one of the first ones to do it in the Ann Arbor area. Delicious Korean food. It's part of the Zingerman's family of businesses, and the chef of Miss Kim is also very cool and kind of an activist. Oh, someone works there. Awesome. Miss Kim is a good spot. Great. Well, you should definitely ask Sarah about it. She'll know a lot more than I do. And Sarah, maybe if you know of the other tipless restaurants in Ann Arbor. Oh, cool.
Yeah, I just got here and I started working there because Jihei is a really cool leader in the space. And yeah, so I'm happy to whatever give advice. I'm not as familiar with other restaurants that function on that model, but definitely looking into researching it.
Cool. That's so great. All right. Anything else? Anybody? Well, thanks again for joining. I'll put in my last plug for food literacy for all next semester. And here, you know what? Why don't I'll stop sharing my screen and I'll just put in a link to our website. Here's a link. If anyone is interested in the TFS fellowship that I mentioned, or if you want to share it, now it's a great time to share it with folks because there's still plenty of time to learn about it and apply. So here's a link to the TFS fellowship. And if you're not yet on the mailing list for the SFSI, here's the website, and on the homepage there you can sign up for our newsletters and social media if you're interested in keeping up to date that way. All right, well, thank you so much, everybody. Have a good rest of your Wednesday evening.
Thank you, Lily, and thank you all for joining us for this session. We appreciate everyone who is in attendance today. You all will receive a recording of this Zoom for your future use. And our next session will be on November 17th with the topic of food and environment. So thank you all for being here today. And thank you, Lily, for your wonderful presentation. We appreciate it.
Thanks, everybody.